Bartholin Gland Carcinoma is a malignancy that arises in the Bartholin glands, located on either side of the vaginal opening. These glands are responsible for producing mucus that lubricates the vagina. This type of cancer accounts for less than 5% of vulvar cancers and is most commonly seen in women over the age of 50, especially after menopause. While the exact cause is unknown, several risk factors have been identified. These include increasing age, particularly postmenopausal status, chronic inflammation or cysts in the Bartholin gland, human papillomavirus infection, especially high-risk strains like HPV 16 and 18, lichen sclerosus, a chronic vulvar skin condition, smoking, which increases the risk for many gynecological cancers, and in rare cases, hereditary cancer syndromes may play a role. Bartholin gland carcinoma can often mimic a benign cyst or abscess, leading to delayed diagnosis. Common symptoms include a persistent lump or swelling near the vaginal opening, pain or discomfort, especially during walking or intercourse, unusual bleeding or discharge, unilateral swelling in the vulvar area, enlarged groin lymph nodes, and in advanced stages, ulceration or visible skin changes. Diagnosis usually starts with a clinical examination, where the doctor may detect a firm, fixed mass near the Bartholin gland. This is followed by imaging studies such as pelvic ultrasound, MRI, or CT scans to assess the size and spread of the tumor. However, the definitive diagnosis comes from a biopsy. This involves removing a tissue sample for histological analysis. Histological subtypes of Bartholin gland carcinoma include adenocarcinoma, the most common type, squamous cell carcinoma, adenoid cystic carcinoma, and transitional cell carcinoma, among others. Treatment depends on the tumor's size, stage, and spread. It may include surgery, such as wide local excision or radical vulvectomy. In many cases, inguinofemoral lymph node dissection is also performed. Radiation therapy is used for advanced tumors or when surgical margins are not clear. Chemotherapy is reserved for metastatic or recurrent cases. Common drugs include cisplatin, paclitaxel, and carboplatin. In some cases, targeted therapy or immunotherapy may be explored through clinical trials. Without timely treatment, the cancer can spread locally to the vagina, rectum, or urethra. It may also metastasize to distant organs like the lungs or liver. Other complications include surgical risks such as infection and lymphedema, sexual and urinary dysfunction, and the emotional impact, including anxiety and body image concerns. The prognosis is better when the disease is caught early. For localized tumors, the 5-year survival rate can range from 70 to 90%. However, if the cancer has spread to the lymph nodes or beyond, the survival rate significantly decreases, sometimes to below 20% for distant metastases. After treatment, regular follow-up visits are essential. This typically includes pelvic exams and imaging when needed. HPV vaccination and regular screening may also be recommended, especially for younger women. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.